I'm Dr.K Gireesh, physician, neurophysician and neurosurgeon. As part of the Health Bouquet series, today I like to highlight a very important topic and also to commemorate the World Diabetes Day. I like to speak on the diabetes and the nerve damage. High blood sugar can lead to nerve damage because the vessels supplying the nerve slowly gets occluded. You can prevent it or slow its progress by keeping your blood sugar as close to your target range as possible and maintaining a healthy lifestyle. So, diabetic neuropathy, you call it, and this diabetic neuropathy can in fact be prevented. Very, very important. But once the damage has occurred, that remains or persists. Only thing you can avoid further damage by controlling your sugar with medications. Managing your blood sugar is an essential part of your diabetes care plan. Not only does it help you with the day-to-day wellness, it can also help prevent serious health problems down the road. Very important. Nerve damage is one of the possible complications for having high blood sugar levels for a long time. In fact, high blood sugar damages your nerves, and these nerves may stop sending messages to different parts of your body. And the nerve damage can cause health problems, ranging from a mild numbness to a severe pain that makes it hard to do the normal activities. The pain is very, very severe. Those who have experienced it will understand about it. Half of all people with diabetes have nerve damage, it has been found. The good news is that you can help prevent or delay it by keeping your blood sugar as close to your target levels as possible. When you do this, you will also have more energy and you will feel better. That's important. The symptoms, that is what you feel or what you experience, they usually develop very slowly. It's important that you notice these symptoms as early as possible so that you can take steps to prevent it or prevent them becoming more serious. The types of nerve damage are, you can have more than one type. Symptoms depend on the type of nerve damage for which the nerves are affected. Now let us see what those types are. One is a peripheral nerve damage. That is the peripheral nerves. You will feel like pins and needles or tingling in your feet. Or sometimes, glove and stocking type of numbness. You can also have that numb feel. It can be the feet, it can be the legs, it can be the arms, and these are the usual areas where people do feel diabetes, this sort of numbness. The other symptoms include pain, which is actually increased especially in the night, weakness, then serious foot problems can occur like ulcers, infections, bone and joint pain. Now in the feet, you will find there might be a small ulcer. If it is numb, you won't feel anything. Finally, infection gets in and slowly it starts spreading. And once it spreads at the area where you start feeling it, then you suddenly start the pain. But by the time you find there will be a bag of pus in the foot. So therefore, foot care is very, very important to prevent diabetes. So that is peripheral nerve damage. You may not notice the pressure or injuries causing the blisters or the sores, which can lead to infections. And sometimes, if it extends, gangrene, amputations and all might be essential. So one should see that you must keep your foot clean and well moistened, very important. The second one is autonomic nerve damage, which can affect your heart, bladder, stomach, intestines, the sex organs or eyes. The symptoms are, you get like urine leakage, bladder or bowel symptoms. You can have constipation or diarrhea, then nausea, loss of appetite, then changes in the way your eye adapts to light from dark, then decreased sexual response, then trouble getting an erection in men, then women will have vaginal dryness. So these are some of the effects of diabetes, that is the autonomic nerve damage, you call it. The third one is a proximal nerve damage that is affecting the nerves in the thighs, hips, buttocks or the legs. You might find difficulty in getting up. That's very important. Severe pain in the hip and thigh you can get, as well as in the buttocks. Trouble in getting up from a sitting position. So sometimes you can get stomach pains. So these are some of the proximal nerves. So we have seen the peripheral nerve damage, autonomic nerve damage, proximal nerve damage, and the other one is sometimes individual nerves called focal nerve damage. There is a fourth one. It can affect single nerves, trouble focusing your vision, optic nerve. That is a trouble focusing your vision. You can get optic, or sometimes you get double vision. You get a third nerve palsy you can get, or isolated fourth nerve palsy, aches behind the eye, not able to move one side to the other. Sometimes the seventh nerve can get affected, and weakness in your hand that make you drop things. So these are some of the isolated focal nerves getting damaged. So these are the nerve damages that can occur: peripheral nerve damage, autonomic nerve damage, proximal nerve damage, and focal nerve damage. What are the risk factors for the nerve damage? Anyone with diabetes can develop a nerve damage, but these factors, especially diabetes, increases the risk. So what are those factors we will see? The blood sugar levels are very high, hard to manage, like beyond 200, 250, 300 milligrams it will produce. Having diabetes for a long time, especially if your blood sugar is not controlled. Being overweight, being elderly people more than 45, 50, having high blood pressure, having high cholesterol. These are all the risk factors. They are more prone to get nerve damage when compared to the other persons. Now let's see what are the tips to prevent or delay the nerve damage. Keeping your blood sugar normal is the most important thing. Medication and your diet. This is the most important thing which is in your control. The other things like getting a regular physical activity, limit or avoid taking alcohol, stop smoking, follow a healthy eating plan. That's a diabetic diet which I have already told you, as well as medicines to be taken. So this has got to be strictly adhered to. And when do you want to see the doctor when you develop these symptoms? Call your doctor if you have any of the following symptoms: a cut or a sore on your foot that got infected, very important. A burning, tingling, weakness or pain in your hands, feet that interferes with your daily activities or sleep. Changes in your digestion, nutrition, urination or sexual function. Dizziness or fainting. These are the occasions that you'll have to see a doctor when you're a diabetic. Most people with diabetes can prevent serious nerve damage complications. Regular foot care at home is very, very important. Before going to bed, wash your feet very well and soak it and make it dry. You can apply a moisturizing cream on your feet, and then at any time, if you develop any of those symptoms of nerve damage, which already I have told you, get an appointment with the doctor. Have frequent checkups. That's how we have got to prevent the nerve damage as a complication of diabetes. Thank you very much.